Tonight, your Eye on Health is live in studio. We have Dr. Avery Saporito joining us from Baylor Scott & White, and she's actually a neurologist and specializes in headache disorders, which is a really cool specialty. We were talking about how she got into this. And doctor, tell me, how do you first determine whether that really banging kind of feeling in your head is a headache or a migraine?
Sure, great question. Thanks for having me tonight, by the way. So the two main types of headaches that we think about are tension type and migraine headache. Most often, if it's very severe, you're coming to the doctor, we're probably dealing with migraine, but there are some features that help us distinguish between the two. So tension type, very common, usually it's on both sides of the head, can be coming on with things like caffeine withdrawal, stress, maybe looking at a computer screen for a long time. Usually gets better with over-the-counter medications, but not always. Migraine, on the other hand, usually is on one side of the head, often is throbbing in quality, and those other features that come along with it was what kind of makes the headache a migraine. Nausea, sometimes vomiting, and then sensitivity to surroundings, so light, sound, noise, movement, making it worse.
That makes sense. That makes sense. I know that we were talking about how if you skip a meal or maybe you've been staring at a screen for too long, that really can set off those headaches, but migraines a lot more severe. Also, how do you dictate, how to help severe migraines, how to help those severe symptoms of those conditions?
Yeah, so I think it's really important to know that migraine is not just a headache. It can be very disabling, can really impact people's lives. And really we look at the impact on life and the frequency to see if we need to start either two things. One is a rescue. Most people with migraine need to have something to take when you have a headache to get you back to life. But if you're having a frequent headache, usually 4 or more in a month, or they're very disabling even though they're infrequent, we can sometimes start what's called a preventative, which you take usually on a regular basis to stop them from starting in the first place.
Also virtual treatments. Can you explain that and how that all works?
Sure. So we have a lot of advanced technologies now. We have virtual visits available. We are launching with Baylor Scott & White the Virtual Headache Care product, which basically means it's an easy button. You go to the Baylor Scott & White Headache Care on the website, and if you are a candidate, meaning you're an adult within Texas without some of the high risk factors that can be seen in headaches, then you can basically see usually an advanced practice provider within 24 hours. And then if needed, you can see a headache specialist down the road as well.
And we see that on our screen right there. That is so cool how technology can really bring you face-to-face with doctors so much easier now. How does that app, or does that app cost anything? Is there a subscription plan, so to speak?
So the app itself is free.
Hey, and then, we like that.
And then, of course, there's the copays that come along with your typical insurance for visits. But it's in line with what you would typically pay to see a physician or an advanced practice provider.
I love it. I love it. Just really cost effective. Free. That's cost effective.
Right.
Last question, and this is something I'm really, really interested about, Botox.
Sure.
You can actually have Botox help with migraines and headaches. You know, we know that sometimes it's used for TMJ and symptoms like that. How does this help with these symptoms?
Yeah, so Botox is great. It's been FDA approved for chronic migraine since about 2010. It's only for chronic migraine, which means very frequent headache, at least half the days of the month or more, and at least 8 of those are migraine-like. And then it's very protocolized. Everyone gets the same amount per the studies that we did. And it's nice too because it's done every 12 weeks. So you come to the office, get it done, and then you leave and go on with your day.
I love it. I love it. And I love how you got into this just because you wanted to help the people around you and get into the specialty to help others, for sure.
Absolutely.
And how many Americans, do you know this, how many Americans suffer from migraines and headaches?
I think it's about 40 million.
Okay, a lot.
Yes.
So this is very beneficial for everybody watching, especially here in North Texas. Thank you, Dr. Saporito, for your words of wisdom tonight.